Hello. Hi, I'm Eric Gordon, Medical Director of Gordon Medical Associates, and today is going to be the first in a series of discussions with Dr. Alan McDaniel, who is a board-certified ear, nose, and throat physician, who has just joined us in Santa Rosa, and he specializes in the treatment of chronic fatiguing illnesses, but has a strong background in allergy, and his interest in the fatiguing illnesses has driven him in a way to become an expert in the endocrine system. But today we're going to start off talking about allergy, because I've had difficulty getting my patients who I feel have allergic problems treated over the years, and after talking with you, I've begun to understand why. And let me just frame that with many people who appear to have allergies, chronic sinus problems, chronic fatigue, yet when they go to the allergist, they're told there's nothing, they don't have allergies. So can you fill me in and our listeners about what the story is behind that?
Well, I certainly had exactly the same experience, and that's how I got involved in providing this care myself. When we use the word allergy, we generically mean that the immune system attacks harmless things. Our immune system is supposed to protect us from dangerous bacteria like pneumonia, viruses like smallpox, and poisons, tetanus toxin. And when the immune system begins attacking harmless things like ragweed and dust and cow's milk, it makes us sick for no reason. Now, the immune system has many different pathways by which it exerts its action. There is 4 pathways, actually, there are 4. And many allergists, the majority actually, are taught that only the first of those 4 pathways has any significance. That's the hay fever or immediate hypersensitivity pathway.
Right, the IgE one that everybody gets measured.
The pathway that gives you hives when you've had a penicillin shot, or you can't breathe when you've eaten a peanut that you're allergic to. And so their testing and all of their questions and their treatment strategy is all geared to only one of the pathways of the immune system. But actually there are at least 4 that contribute to making us sick. And that's what is being missed by definition. I had this experience when I was a new assistant professor at the Department of Surgery doing ear surgery. And they put me in charge of the Children's Hospital Pediatric Ear Clinic. And we had a whole bunch of kids with dark purple circles under their eyes and bags under their bags, and their nose was swollen and the turbinates were purple. They were all mouth breathers. They had eczema, and they had had 3 sets of tubes, and then they tried to repair the eardrum and then did a mastoidectomy, and they were running mucus out of both ears. So I sent the kids all to the pediatric allergy clinic, and they did little scratch tests on the back and a couple of bumps on the arm. And half of them, they said, were not allergic. And then the other half, they said they were allergic, and they put them on shots. But the problem was there was no clinical difference between the half that was said to be allergic and the half that was said to have no allergies.
Now, that's a very good point. I just want to reinforce, is when you said clinical difference. So it really wasn't what the test showed, but the fact that the patient was reacting the same way.
Absolutely. You have to know what the test reveals. And the test they were doing reveals only type 1 immediate hypersensitivity, IgE.
Right.
So I thought at the time, well, their test isn't so good and they're missing food allergy, which they were. And then I later found out that they were ignoring the type 2, type 3, type 4 immune responses, which really are very important, but in the belief system of American allergists had no particular credence or respectability. So I started looking at alternative approaches to allergy, and it was easy. I began with the ENT Allergy Academy and became pretty well known there. I was invited to join their faculty. I taught basic courses for a while. I taught advanced courses for a while. And really the late and delayed reactions are so important for fungus and mold and dust and things that we're in all the time.
Right. Okay. Yeah, this isn't the occasional allergic reaction, because we have dust mites and mold throughout the year.
constantly. And the type of reactions they produce are different from the hay fever. The immediate hypersensitivity, type 1 pathway,
Right.
is mediated through a chemical called histamine. So it gives you red, itchy, sneezy, watery, tickly symptoms that we all associate with hay fever. No problem, everybody agrees with that. But the latent delayed hypersensitivity give you asthma, give you eczema, give you sinus, give you headaches. And these are reactions that cause a lot of confusion, and because of the dogmatic issues are not well understood, but certainly respond nicely to treatment when you look for them.
Ah, yes, looking for them. So in a few minutes, give me a quick overview of how you start looking for these.
Well, of course, the first thing is a good history from your patient and what's bothering you. If they simply got hay fever only when the grass is blooming, that's no problem. But when they are chronically fatigued, chronic headaches, bronchitis, asthma, then you know that you need to expand your scope. When we test, there are blood tests for allergy.
Mhm.
They're excellent for hay fever allergy,
Right.
but they're not good. They don't at all record the latent delayed. So if you want to look at somebody with these latent delayed symptoms, you
Right.
need to do skin testing, and you need to check them and measure their skin test reactions 24 hours later, 48 hours later.
Okay, measure was the word you used.
Absolutely.
Right, right.
Yeah.
Because most of the time you go to the allergist, they'll give you the skin prick, and they'll take a look in 10 minutes or half an hour maybe.
And that's when the immediate reaction shows up. And then they stop thinking about it, because in their belief system, anything else is immaterial, and it's very important, actually.
And so when you do the skin test, you take a look, and then what's your next approach? I know you have several, so what are they?
Well, there are a variety of ways that we can mellow out an immune response. And the best way, or the classical way, is to reintroduce the harmless allergen to which the patient has become inappropriately sensitized back into his system to develop tolerance. And we can do that with the classic from about 1910 was allergy shots.
Right.
You just put a little bit under the skin, the body accepts that, then the next week you give them a little bit more, the body learns to accept that, and every week you give a little more until they're on a good dose. And that now can be done with drops under the tongue.
Ah, okay. Well, that's a nice addition.
It is a nice addition.
Yeah. Well, so you find that, does it work as well?
It works every bit as well, and a lot of patients prefer it. As a matter of fact, they think they get a cleaner result, and they certainly don't have to go and sit in my office for 30 minutes and pay a copay after a shot once a week. And so it seems to be well received and effective. I've published a paper with my friend Diego on the effectiveness, comparing shots and drops.
Oh, okay.
It works
That's
out well.
exciting, because
Yeah,
the
it's good.
shots can be very difficult for lots of people.
It's inconvenient
Yeah.
at best.
Okay. And then, so that's one method. And what about for people who react really severely and looking for something that's going to act quick to make their system a little more tolerant, a little faster?
Well, we have a couple of other options in the toolbox. One that's been used since the 60s is called neutralization. We take just a little tiny bit of whatever it is they're allergic to. It's usually used for foods, and that will block a reaction.
So you have to find the right dose.
That's the challenge.
Okay.
And then a newer option is low-dose allergen immunotherapy, LDA. And that's developed in the 60s and 70s by a Brit, Leonard McEwen. And he mixes a little bit of every doggone thing you could possibly be allergic to with an enzyme from the mollusk bivalve muscle, and we inject it under the skin, and it's magic. Something about the enzyme persuades the immune system that anything in there is okay, and it will. An injection is given every 2 months.
Right.
And usually within about 3 injections, people can be pretty sure this stuff is helping them. We don't really know how it works, but it usually does, and very nicely.
Yeah, that's exciting. It's nice to have options.
It is.
For people. And so I think what we'll do is we'll close here, and I think next time we'll talk a little bit more about cortisol and insulin.
All right.